I'm Dr. John, and this is Think Your Health. And in this channel, we talk about all things health to keep you young. And in this video, we're going to look at Pravastatin, uses and side effects. Coming up. Pravastatin. What is it used for? Pravastatin is a prescription drug used to lower bad cholesterol called LDL and raise good cholesterol called HDL. It is also used to lower another fat called triglycerides. It belongs to a family of drugs called statins. Brand name is Pravachol. How does Pravastatin work? Pravastatin works by blocking an enzyme called HMG coenzyme A reductase. This enzyme is needed to make cholesterol in your body. This way, it lowers the cholesterol level in your blood. How long does it take before Pravastatin starts working? This medication is in your body system within 1.5 to 2 hours after oral intake. However, for its full effect, it'll take at least 4 weeks for changes to be seen in your cholesterol. It goes without saying that this should be combined with lifestyle changes and a healthy diet. How effective is this medication? And according to studies, and I left the link in the description below, with 40 milligrams of Pravastatin daily, total cholesterol can be reduced by 25% to 34% with a very consistent risk reduction of 24% of death from cardiovascular disease. Dosing and administration of Pravastatin. The generic tablet comes in the following doses: 10 milligrams, 20 milligrams, 40 milligrams, and 80 milligrams. You can take this medication with or without food. Typically, you would want to start at the lowest dose, increase the dose gradually, monitoring for side effects. This is especially true for older adults. Can you drink alcohol while taking Pravastatin? Preferably, you want to limit intake of alcohol as much as you can, as it can increase the risk of liver problems. Side effects, in particular liver problems, will be discussed later in this video. What should you not take with Pravastatin? Do not take any rice yeast products. This is because rice yeast contains a statin, and a combination with Pravachol can increase the risk of liver and muscle injury. You should also avoid grapefruit or grapefruit juice with this medication. This is because it can increase the amount of the drug in your body and you will be prone to more side effects. Is Lipitor and Pravachol the same drug? Both drugs belong to the same family of drugs called statins, but they are different medications. The generic name for Lipitor is Pravastatin. And if you're interested to learn more about Pravastatin, click on this link above. What are the common side effects of this drug? All drugs may cause side effects. The goal of this channel is to educate you if you're on a drug, how it works, and what you might expect in terms of common side effects. There will always be some people who have no or mild side effects. And if you do have side effects, call your doctor as soon as possible. Do not suddenly stop any medication without consulting your healthcare provider. If you're interested in other medications with side effects, click on this link above. Common side effects, and this list is by no means exhaustive. Muscle pain, muscle cramps is the most common reported side effect. Then there are GI side effects such as abdominal pain, nausea, diarrhea, and heartburn. Headache, angina pectoris, weakness and fatigue, memory problems, rash, elevated liver enzymes, upper respiratory tract infection, chest pain. I've left a link to the source article below. When do you have to call your healthcare provider? As soon as possible. If you're having problems peeing, with swelling of your feet and arms, increasingly fatigued, these could all be signs of kidney problems. If your urine becomes dark, that is dark brown, coupled with muscle pain and weakness and even a fever, these could all be symptoms of muscle breakdown, increasing your chance of acute kidney injury. And this is also called rhabdomyolysis. If your skin becomes yellow and your stool becomes lighter in color, combined with fatigue and weakness, abdominal pain, as well as dark urine, this could all be signs of liver injury. Can you take this medication if you're pregnant? This medication is not recommended in pregnancy. And if you're trying for a baby, you should stop the medication 3 months before. You're at an increased risk for birth defects. What medications interact with Pravastatin? Here are a list of some of the drugs which can cause drug interaction. There are many more, and this list is by no means exhaustive. Talk to your healthcare provider, your pharmacist, about possible drug interactions if you're taking Pravastatin. And if you're interested in another video, click right here or click right here. Have a good day and think your health. Okay, done. I see the red light, the audio battery went out. Does this look menacing? Done. Bye.